Welcome to the deep dive. Today, we're really digging into something transformative. The journey of health information technology, health IT in the U.S. healthcare system.
Yeah,
We're working from this really comprehensive, data-packed study, giving us a clear view, almost like an inside look at the huge progress made and, well, the bump still in the road.
absolutely. And our mission today really is to unpack how this tech has genuinely reshaped patient care. We want to highlight the big wins, the major advancements, but also uh, be honest about the hurdles still out there for achieving care that's truly focused on you, the patient.
Okay, let's dive in then. The sheer scale of change. It's pretty remarkable. Since 2009, think about this, a tenfold increase in electronic health record EHR use in hospitals. Tenfold.
Wow.
And for doctors in their offices, a fivefold increase. It's like we flipped a switch almost.
It really feels like that sometimes. And, that surge wasn't just organic growth. What's really key here is how this massive EHR uptake, heavily pushed by federal incentives like the HITECH Act, remember that?
Yeah.
That really aimed for meaningful use. That whole foundation allowed progress in four main areas. Getting data to flow between systems interoperability, e-prescribing, electronic reporting for public health, and patient access. Big buckets.
Huge infrastructure shifts. Okay,
Right.
interoperability. This is where the data gets really fascinating, I think. By 2023, get this, 70% of hospitals were routinely doing all four key things for data exchange. Finding patient info, sending it, receiving it, and actually integrating it. That's way up from only 23% back in 2014.
A massive jump.
But here's the twist. For doctors and private practices, progress is, well, slower. Only 16% were doing all four by 2021. Why the gap, do you think?
Yeah, that's a really important point. Hospitals often have, bigger IT teams, more resources maybe. Smaller practices can face tougher hurdles implementing and really using these sometimes complex systems. But let's connect that to a huge success story. E-prescribing. It's almost everywhere now. Pharmacies have basically universally adopted it. And 92% of prescribers are set up for it. Even for controlled substances, the electronic prescribing, EPCS, that surged too. Nearly three-quarters of prescribers were using it by 2021.
And that's more than just convenience, right?
Oh, absolutely. Beyond
Yeah.
convenience, this widespread EPCS creates a vital digital trail. It makes it much harder for bad opioid prescriptions to get through. It's a real data-backed tool in fighting the opioid crisis.
Okay, so it's helping with individual care, major crises. What about the bigger picture, like public health?
Right. That digital shift has major public health benefits too. Electronic reporting has jumped. For instance, 90% of hospitals could send immunization data electronically by 2022. That's crucial for tracking.
And for you, the listener, as a patient, access is totally different now. 97% of hospitals let you view your medical records online. And more than half of people say they actually look at their health info using patient portals.
Yeah. Think about the old days. Trying to get your records if you moved. Faxes, phone calls,
Yeah,
a nightmare. We're chipping away at those barriers.
definitely.
And there's a but here.
Despite all these leaps, the study flags ongoing issues. We're still wrestling with true interoperability, making sure systems really talk smoothly. There are usability problems with the tech itself, security worries, and critically, gaps in access.
Gaps, like who's being left behind.
Yeah, inequities. It hits lower resource providers harder, and certain patient groups just aren't getting the same benefits. So we've built these digital highways, but there are still, potholes, and not everyone has easy access to the on-ramp, especially in underserved areas. Right. So given those challenges, usability, equity, what's the path forward according to the study? It really stresses ongoing teamwork, focusing on better data standards, getting everyone speaking the same digital language, plus tackling information blocking, that's when access is deliberately hindered, and keeping standards like the U.S. core data for interoperability updated.
Exactly. It's about making sure that data doesn't just exist, but flows smoothly, securely, and is actually useful for clinicians and for you without hitting roadblocks.
It sounds like a continuous improvement process.
It really is. This deep dive reveals this incredible ongoing change in U.S. healthcare thanks to technology. We're moving steadily towards care that's more centered around the patient. But the next phase, maybe the next 25 years, it demands a shift from just getting the IT to really perfecting that infrastructure, making sure your data flows safely and seamlessly.
So here's something to think about. Imagine a future where every bit of your health info is instantly available to the right doctor at the right time, wherever you are, no hurdles. What difference would that truly make to your health journey?